asked by Human Resources to set up some meetings so that Eric Herppich could come and talk about the benefits changes that are going on for the healthcare. I will say, as you may have just heard, this session is being recorded and will be put up on our YouTube page, I think. So I just wanted to make sure that everyone was aware of that. So without further ado, I will introduce Eric Herppich, who is going to give a brief presentation and then answer questions about the healthcare packages. So thank you very much, Eric.
Thanks, Karen and Amy, for inviting me. I appreciate the opportunity to go through some information. For those of you who I don't know, my name is Eric Herppich. I'm the Director of Benefits and Compensation. I've been here at Oakland University for about 3.5 years. So nice to meet everybody and see some names that are somewhat familiar anyway. What I want to do today is talk about and maybe just summarize some information regarding insurance plans for open enrollment for 2022. And then also talk about open enrollment dates and timelines and processes and contact information for making changes for this year's open enrollment, which is underway. So let me first talk about open enrollment. Open enrollment started on Monday, yesterday, and runs through midnight on October 29th. And this is the period of time each year where faculty and staff can make changes to their insurance plans, their elections for the following year, or if they don't want to make any changes, it's an opportunity to review what you've got in place and refamiliarize yourself with that for 2022. We are having our annual benefit fair tomorrow. The benefit fair is going to run from 9 a.m. to 1 a.m. It's going to be over at the rec center. A couple things that are going to be different this year than what you've seen, not necessarily last year, but in years prior, is the attendance at the benefit fair is going to be somewhat limited from the insurance carrier standpoint. As an example, Blue Cross will not be in attendance in person at the benefit fair this year. Delta Dental will not be in person at the benefit fair this year. There will be several vendors and carriers that will be there, but some will not due to the COVID restrictions those companies have for their employees. Just another footnote or item to share with everybody, not last year, but in years past, we would have kiosks at the benefit fair where staff from Human Resources would be there to assist faculty and staff who are going through the open enrollment process to either review what they've got in place or make changes. Again, due to COVID, that will not be available this year during the benefit fair. I'll be giving you contact information towards the end of the PowerPoint slide presentation for the names of the 3 primary individuals, at least in UHR, who are responsible for assisting faculty and staff to go through the open enrollment process. Very knowledgeable, customer service oriented individuals who can even connect with your computer and kind of watch as you're going through your open enrollment process and help you make sure you're doing everything correctly for 2022. So as it relates to the particularly the medical benefit plans themselves, there aren't any changes to the plans. The plans are the same for 2022 as they were in 2021. If you've looked at your benefit guide yet, you will notice, though, there are rate increases in 2022 that push these insurance rates higher than they were in 2021. And I can just briefly explain the process, of how that occurs. Every year from our carriers, both Priority and Blue Cross, we get preliminary rates from them in the fall time. When we get those preliminary rates, the university has an insurance broker that we use that works to negotiate those rates and attempts to reduce any increases as much as possible. That process has been very successful in the last 2 or 3 years. We have had some mostly stabilized rates and some reduced rates in the last 2 or 3 years. We were not able to obtain that this year. Priority and Blue Cross came back and were not willing to provide any reductions to their rate increases from their preliminary rates. So when we look at the rate increases, again, this is all in your open enrollment benefit guide. The rates for Priority Health, the Healthy by Choice, Achievement, HMO, those rates were increased by about 6.9% over the 2021 rates. The Priority Health Choice buy-up plan, those rates actually did get reduced by about 11% based on Priority's underwriting methodology. And then Blue Care Network and Blue Cross Blue Shield had significantly larger increases. Those plans, those rates increased anywhere from 12 to 15% over the 2021 rates. So much more significant there on the Blue Cross side than on the Priority Health side. Again, we're not happy about the outcome. We did, again, attempt to negotiate like we have in years past, but we're not successful in getting any relief on these rate increases from our carriers. So as we go through open enrollment, one of the primary questions that our staff usually gets is, if I don't want to make any changes, do I have to do anything? And the response to that question is no, you don't have to do anything. If you want everything that you have in 2021 to carry over into 2022, you don't have to do anything, with one exception. The one exception is your flexible spending accounts. If you are participating or want to participate in the flexible spending account program, for plans for expenses that are medical related, that's the healthcare side of the flexible spending account program. Or if you're setting aside money for daycare or dependent care expenses, that is a separate account under the flexible spending account program. So if you're participating in either of those programs and you did participate in 2021, you must re-enroll in 2022. That will none of that will, your election for 2021 will not roll over into 2022 automatically. You have to make a new election each year. If you did not participate in the flexible spending account program in 2021, you would have to obviously enroll if you wanted to participate in 2022. There were a lot of changes during the pandemic. We had the maximum allotments of what you could put in, particularly on the daycare savings side, was increased during the pandemic. We had rollover amounts that used to be limited or capped are now unlimited during the pandemic. So a lot of changes. It's been a very fluid process. So I would encourage you to look at your open enrollment guide. We've put some examples in that guide in the first couple of pages of the document where we talk about what's changing for 2022. And we describe the flexible spending accounts and how those rollovers are going to be handled for next year. And I would encourage you to have a conversation with one of the staff members in HR about that, the flexible spending account, if you want to re-enroll or enroll, because a lot of times that's a very specific conversation, right? How much do I have left in my account? How much is going to roll over? How much do I want to plan to use in 2022? Because once you make that election, outside of a qualifying event, you can't make any changes during the course of the next year. So you want to be very thoughtful and deliberate as far as how much money you want to put into that flexible spending account program to make sure you've properly allocated the money that you are going to be spending based on your anticipated needs. Sort of my last sort of encouraging statement is we're here to help you and answer your questions. And a lot of these questions are very individual based. So please contact any one of these three people in HR, Corey, Monica, or Kara. They're very responsive. They'll get back to you very quickly. Email is usually the best way to get a hold of them. And again, they can answer your questions and walk with you through the open enrollment process to make sure whatever changes you want to make are made. I've been here a couple of years now, and I'm hearing more and more where faculty or staff are maybe making decisions based on communications with, other faculty or staff. And that's great and fine to have conversations with, other faculty maybe about your insurances. But if you've got questions that are that you need answers to make sure you make the right elections, you really want to talk to the benefits folks to make sure you're getting timely and the most accurate information. And again, we can help you walk through the open enrollment process to make sure you are making the changes that need to be made to make sure your intentions are carried forward into 2022. So that was the information, a couple of key points I wanted just to share with everybody. And then I wanted to kind of open up for questions and answers. And I'm not sure, Amy, do you want me to kind of go through some of the questions that came up yesterday and answer those before we open the floor to other questions, or do you want to approach it differently? Or Karen?
I mean, I think maybe let the questions come out first.
Okay.
From the faculty. And faculty, you can either put questions in the chat or you can raise your Zoom hand there. And Karen and I will get them all read off. So feel free, ask questions now. Eric, if you can stop sharing, that would be great, please.
Very good, I will.
Thank you.
Okay, I have a question. I don't know how to raise hand. I'm sorry.
Go ahead, Peter, you're fine. Go ahead.
Yeah, okay. Well, I noticed that for if you got your children insured, it can there is an age limitation, right? I have 2 children. My daughter is on her own by now. She doesn't need my insurance, but my son is in a graduate school somewhere in California. And he is 23. So what is the age limit by which I cannot insure him anymore?
So under the Affordable Care Act, you can cover your children up to the end of the calendar year in which they turn 26.
26. Oh, I
26.
still have to. I don't have to worry about it now. All right.
Right, not now.
Okay.
Correct.
Okay. Okay. Thanks. That's my. I guess that's my only question.
Okay.
And another thing is, I haven't participated with flexible spending, but they kept sending me letters, whatever. So I'm not automatically deducted, I guess, right? Or something.
No, you won't be a participant in the flexible spending account program unless you enroll and process that, sign off on documents, and actually enroll. So if you don't do anything and you have not participated in years past, you won't be participating in the future.
Okay, I see. I will talk to you said writing to Britain, right? That's Corey Britain.
Yes.
Okay. Another one is Monica. Her name, her email is Hines, Haines.
Yes.
Okay, I see. All right, I will talk to them. As you said, I don't have to do anything if I don't plan any change, right?
Right. If you don't want to make any changes, whatever you have in this year will roll over into next year. The flexible spending account is the only thing that is not included in there.
Oh, I have. You said they increased the rate. I have been enrolled at Priority House by Choice. You know that program, right?
Yes.
It's called Priority. You have to like pass their criteria, like not smoking and stuff like that. How much did they increase for that?
That the increase for that plan was the increased cost for that plan is 6.9% higher than what it was this year in 2021.
So so that means that Oakland, how does that work? Oakland contribute half and I contribute half, right?
No, Oakland. You want to address that, Amy? It's 95%, 5%, right? Still.
Okay.
Correct. It's 95% of the lowest cost plan is what Oakland contributes for year 1 and year 2 of this contract. And in year 3 of this contract, starting in January of 2024, Oakland will contribute 90% of only the lowest cost plan.
Okay, the 90%, only the lowest cost plan. Yeah, I think I'm, am I doing the lowest cost plan or no?
You are.
Yeah, I think I am, yeah. All right, so then 6% increase is not much to me because 90% is covered by the university. Am I right or I'm wrong? I don't know.
I mean, it's a pretty big increase. And some other, I mean, the other insurance plans went up 15%. So for some people,
you said 6%, right? Not
6% for Priority Health, but there's other health insurance plans that our members are on as well. So yes, the increase rates were much higher than in previous years.
Okay, so in terms of, well, I'm sorry, I'm asking this question. So you said a 6% increase is for the overall rate or the rate that I have to contribute?
The rate increase for priority is 6.9%, and that's the increase to the total premium. And then the total premium is divided by 95% paid by the university and 5% paid by the faculty member.
So that means with regard to the actual increase applied to the individual faculty, it is only 7%, say, of the 5% of the total increase then.
If you are a full-time faculty, Peter, and if you are choosing the cheapest plan, that is accurate. But if you are not a full-time faculty member, or if you are choosing one of the more expensive plans, those numbers aren't accurate and they're much higher. So it depends. So for you, yes, that's true.
Yeah. Okay, thank you. You are very accurate. You see, I'm a mathematician, but sometimes when it comes down to numbers, I'm confused. Because as a mathematician, we teach abstract theory. We don't apply the stuff on numbers. Students always complain about us.
All right, I'm going to ask you a couple other questions. Eric, can you talk about our vision plans?
Sure. There's nothing changing with our vision plans. So we still offer the Davis Vision program, and we still offer the Blue Cross VSP program. So I think generally we have employees that switch from year to year. They may have Davis one year and switch to the Blue Cross plan the next year, back and forth. None of that is changing for 2022. That is all staying the same as it has been.
Elizabeth, did you get your question answered about where to find the benefits package? It's in your eSpace.
Yes, someone provided the link. Thank you.
Perfect. Can you talk a little bit about Medicare? We've got the same questions from yesterday, Eric. So I received a letter from Oakland University regarding Medicare. I'm getting SSI and Medicare A. Do I need to do anything with OU at this point? I do not plan on getting Medicare B.
And is this coming from someone who's a full-time faculty member?
Correct.
Because I have to say, Amy, I want to follow up. I want to follow up on that because I can't answer that question specifically as we sit here today. I'm just making a note here.
Yep. Another one about children aging out. My daughter is turning 26 next May. So I am assuming she can stay on my plan until the end of 2022, correct? And then is she automatically disenrolled? Are there options to purchase coverage for family members that are no longer age eligible?
Right, there's no option to purchase coverage that are no longer age eligible and correct. For a son or daughter who turns 26 in May of 2022, that coverage they have on your plan will continue until December of 2022.
Okay, I got to
hold on, Peter.
Nice meeting everyone. Thank you.
Can you speak a little bit to why the difference in increases are so disparate between Priority Health and then the two Blue Cross plans, one that goes up to something like 15% of an increase? Can you talk about that a little?
Yeah, I mean, so our plans at Oakland University, there's two ways for employers to deliver healthcare plans to their employees. One is by having fully insured plans, and the other is having self-insured plans. Self-insured plans are plans in which coverage is defined by the carrier and the employer, depending on what plan they want to offer or either negotiate with their employees. And by being self-insured, what that means is that the employer has to pay the actual claims, the actual costs that are incurred by their employees that are utilizing those healthcare plans. So, when you talk about self-insured plans, you talk about what's the claims experience, what are the actual costs for those plans. You also have to overlay, sort of stopgap insurance so that you're limiting your liability against very expensive claims. So it's a complicated process. Oakland University is not self-insured. These plans are not self-insured. We don't pay by claims. We are fully insured. What that means is there's a plan that's laid out in your open enrollment guide, and those plans have a set cost, and those costs are determined by the carrier. So Priority and Blue Cross have an underwriting methodology that's proprietary that they're not going to share with the employers that use these plans. But it's similar to when you're getting quotes for life insurance, or maybe if you're talking about a retirement plan, what's the actuarial value of a benefit? When Priority and Blue Cross go through underwriting, they make a lot of assumptions as it relates to healthcare costs, the potential uses of healthcare services for the employees on a particular plan. They make assumptions based on the age of individuals that are being covered. They have all these different assumptions they make, and through underwriting, they try to predict what their costs are going to be and set rates that minimally cover what their anticipated costs are going to be for each plan year. So I can't answer specifically why Priority's increase was less than Blue Cross, other than their underwriting process, again, which we're not privy to understanding exactly how those calculations are drawn. But through their underwriting process, they've determined what those rates are going to be. And to the extent we can negotiate those rates down, we try to do that. But at the end of the day, those carriers set the rates, and we're bound by those plans having those costs attached to them.
I mean, I think this is a follow-up. I'm not sure what you'll have to add to it, but why didn't Oakland fight harder for lower costs in the Blue Cross plans? Because those are the plans that receive higher increases, because Oakland's contribution isn't based on the higher plan. So why didn't Oakland fight harder?
Oakland fought equally hard with both Priority and Blue Cross. We don't distinguish and take a lesser approach with either carrier. We have these carriers compete against each other. They understand that this is about their bottom line in their business. So we make sure they understand it's in their best interest to be as competitive as possible, because if they're not, they may lose revenue from employees that are going to switch to a different plan. So we make sure they understand the possible outcomes of their decision to not be competitive with regard to their rates. But again, we can't make the decision for them. They're gonna determine what their final rates are going to be. And again, we negotiate equally hard with both carriers, and we try to create that competition against one another to, again, try to drive those rates down as best we can.
I think Carolyn Tiepo has a question.
Yes, so my question is specifically about the Blue Care Network Healthy Blue Living option. In my benefits book that ended in 2020, December 31st of 2020, on page 15, it indicated that if you continue in that plan, you would continue at the same level, either enhanced or standard, that you were at the end of the preceding year. So then when January of 2021 came around, I received a letter from Blue Care Network indicating that I was in the enhanced, but then I would have to again qualify for the enhanced, which was different than the 2 years that I had it preceding. And they indicated it was because I was considered a new enrollee because our contract had expired. So now I'm a new enrollee in this plan, even though I've had the plan. So my question is, if I choose that option again, will I be considered a new enrollee and have to qualify for a third year in a row?
Yeah, so I guess let's talk about qualification for both Priority and Blue Care Network. Let me just say that this is the easiest thing to address first. Priority is very straightforward and simple, right? You have to have yourself and your spouse both have to qualify. They have to do it every year. They're encouraged to do it within the first 90 days, but you can, as the year goes on, qualify at a later date. You just won't get the benefit of the lower rates until you do actually qualify. So that's very straightforward on the Priority side. Blue Care Network is not that straightforward. Blue Care Network, to qualify, they have their six different factors they utilize to qualify somebody for the enhanced plan. And the doctor is supposed to rate those 6 categories for their patient based on an ABC sort of structure. And the need to recertify every year is based on the score you've got on those 6 factors from the prior year. There's a lot of variables that go into the Blue Care Network determination as to how often you have to certify. So that's not something, unfortunately, that I can give you direction on. That really is a conversation you need to have with your physician. Your physician should be familiar with the certification process. He or she is submitting the documentation required by Blue Care Network to certify into the enhanced benefits. So that conversation about whether you qualify or not, whether you qualified last year and have to requalify this year, that's something that's going to have to be handled between you and your physician when you go through, and get your physical or to get that medical documentation in order for the physician to submit to Blue Care Network for that determination.
This wasn't related to the healthy or any health related information. This was related specifically to Blue Care Network when I called, telling me that it was because I was a new enrollee and I wasn't considered a continuing member because our contract had expired and then I had a new contract. So was that because Oakland gave me a 1-year contract for that extension period? And so then I was considered a new enrollee with Blue Care Network again. So then this year I'm asking, am I considered a new enrollee into Blue Care Network again for 2022 if I select that program? It had nothing to do with my health or my physician. It was from Blue Care Network's end.
There should be nothing. A new enrollee would be someone who is in priority in 2021 and moves to Blue Care Network in 2022. That would be considered a new enrollee into Blue Care Network. It has nothing to do with a labor contract or anything like that. So I don't know. I don't understand the response from Blue Cross on that. But that's the only way you would be considered a new enrollee is if you switch from, as an example, from priority to Blue Care Network from 2021 to 2022. Blue Care Network would consider you a new enrollee for 2022 because you weren't in their plan in the year prior.
Can you speak a little bit to changes in Blue Cross Blue Shield premiums relative to Priority Health, which I think we've kind of addressed, but this person couldn't log on right away. And then how the prescription costs are significantly different across those two plans.
Did you want me to go through the cost breakdown again, Amy? For I'll just summarize it again. So Priority's healthcare increase and Blue Cross's increases for the year 2022 are based on their each company's own underwriting methodology to determine what the costs for healthcare services are going to be under the plan that we have in place for our faculty and staff, as well as any anticipated usage of those healthcare services. They have a lot of factors they put into their underwriting methodology to determine what the appropriate rate should be to make sure they have sufficiently, covered their expenses for projected healthcare costs from year to year. So those methodologies are proprietary. We don't know how they determine those factors or weight those factors, but they do have a process they go through to determine what the rates ought to be for these plans. And again, we try to negotiate with those carriers to get the most competitive rates possible, but ultimately, the outcome of what those rates are going to be is determined by Priority and by Blue Cross.
Could you pull up the screen for just a quick second, Eric, and show those rates again?
Sure.
Casey, is that what you're asking to see? I don't know if Casey has access to volume right now, but if you could show those really quickly, that would
Sure.
help.
Hang on one second.
Can you hear me, Amy?
I can hear you, Casey.
Okay. Yeah, I was just wondering about the oh wait, I may be. Okay. So I was just asking about the actual amounts.
Is this the screen you're looking for, Casey?
Yeah, that was the one when I finally got to log on. This is the one that I missed. So I was just wondering about those differences. And I think when he was talking about the underwriting and all that, is he saying that that's why he can't say if the prescription costs are higher in one plan versus the other? So that's what.
Well, I'm sorry, the prescription, there's no separate prescription costs. All these plans include prescription coverage. So these rates include prescription coverage. And again, the plans themselves have not changed from this year to next year, and the plans do include prescription coverage, and the copays are all identified in the open enrollment guide.
Yeah, I only say that because when I had Priority Health, it was a lot of prescriptions that they didn't cover. And then once I got to Blue Cross, they covered them. So I didn't know if those things were different. So looking at this table here, could you just briefly talk about, okay, so what is the monthly premium that comes out of our check? Which column is that?
That's the employee contribution column on the far right, highlighted in blue.
Okay, it is. Okay, all right, I got you.
Yep.
Okay, thank you so much then.
You're welcome.
I did have specific questions about rates and increases. And so with the Priority Health, you'll see that your increases, the Priority Health by choice, your increase went up to 6.9%. But someone was just asking about the Blue Cross Blue Shield PPO, and the employee contribution there went up anywhere from 37 to 43%, depending on whether you were single or two-party or family. So the percentages of increases for employees is vastly different depending on the plan. Karen, what other questions am I missing in there? Oh, the ones about, did you get any answers about auto insurance? That came up a bunch yesterday, Eric.
Yeah. So yeah, there were several questions that came up yesterday regarding individuals that are looking to either renew or initiate auto insurance coverage, and the request that you're getting from your auto insurance company for some sort of a statement or documentation from your insurance provider that identifies how healthcare costs are covered or not covered, I suppose, under your employer's insurance plan to help determine whether or not the PIP insurance should be purchased, and if so, at what level. Those statements and that documentation under Michigan law they need to be provided by the plan administrator for employer plans. If we were self-insured, that would be the university. But we are not self-insured, we are fully insured. So the plan administrators for the university's plans are the carriers, which is Priority and Blue Cross, either Blue Care Network or Blue Cross Blue Shield. So those statements and that documentation are required to be obtained through those plan administrators here in our case. So if you're looking for information that your auto insurance company is requesting that you provide, you want to call the customer service contact number on the back of your insurance card. They are familiar with these needs. We're not the only employer who they have that are fully insured that they have to handle this activity for. So if you make that contact with your insurance provider, they can provide, I think they've got even sample or standard statements now they're using when those requests come in. So that's where you need to go to get that information as it relates to the coordinated healthcare coverage under your auto insurance plan.
And we have another question in the chat about the monthly employee contribution for the HMOs. Those are for both the people who qualify for the enhanced, but also the people who don't meet the qualification. Is that correct? And then the difference is that the people with a better coverage pay lower co-pays, and that's, is that correct?
The monthly employee contribution column is going to vary based on the total cost of the healthcare plan you select, less the university's contribution towards any healthcare plan you select. So if you look at that middle column, the university contribution column, that's the same for each and every healthcare plan that may be selected. The total premium is going to be the same, the middle column is going to be the same, and then the only column that's really going to vary then is going to be the employee contribution column, because that's going to be the difference if you select Priority versus Blue Care Network or the PPO, because the university's costs are fixed based on, you're right, based on that Priority enhanced benefit level at the bottom.
Okay.
Elizabeth, is that what you were asking? I'm not convinced that's what Elizabeth was just asking.
Sure.
Oh, sorry, I had to just stop for a minute, but
I'm sorry, it's not what I was asking. I was just trying to type that into the chat, but this is faster. My question is, if I'm in one of the HMOs, say the Priority Health HMO, and do not qualify for that enhanced benefit, does that increase that 60, the 25 or 64 or $77 employee contribution? Because is the monthly contribution going to change, or is it just the copay that's going to change?
So what will happen with priority is if you do not qualify for the Healthy by Choice Achievement HMO, you will be automatically put into the Priority Health Standard Plan. And if you look at the faculty open enrollment guide on page 15, that shows you the deductible, the copay lineup for the choice plan versus the standard plan. So if you qualify for the choice plan, you'll have those benefits outlined in the choice column, and the contributions in blue, the 2580, 6450, and 7740 will be your monthly contribution amounts. If for some reason you do not qualify, your contributions amounts stay the same. It'll still be the 2580, 6450, and 7740, but you will be moved to the standard plan, which does have a moderate deductible, some co-insurance costs, and higher copays for certain services. So your paycheck will not be affected by the amount of the contribution, but the costs you'll have when you seek medical services will be elevated based on being in that standard plan.
Okay, that's the question I think she was asking. Thank you.
Yep.
Other questions?
So Amy, maybe what I can do while we're waiting, see if there's any other questions, is go through some of the questions that popped up yesterday that I gave you some responses to today, and maybe just hit on those in case someone's maybe thinking about it or maybe didn't think about it, and I can maybe discuss those while potentially more questions become available.
Sure.
One of the questions that came up a couple of times at yesterday's session was, are there any pre-existing conditions if I change healthcare plans? So if I switch from Priority to Blue Cross or vice versa, are there any pre-existing conditions that limit my coverage? And the answer to that is no. The current state of the Affordable Care Act eliminated those pre-existing conditions. So that's one item that came up a couple times yesterday. Another question that came up yesterday a few times was the flexible spending accounts and the rollover limitations, particularly on the medical side. So on the medical side, the amount of money that got rolled over from one plan year to the next prior to the pandemic was limited to, I think it was $500 one year, and I think in 2019 it was increased to $550. But during the pandemic, those rollover amounts have been uncapped. So for 2021, any funds in your medical FSA that aren't spent, those all will be rolled over into 2022 without limitation. And again, unless something changes, the plan is for 2022 into 2023, that cap will be back in place, which I think is going to be the $550, again, subject to change. But so think about that too. For 2022 to 2023, there will be a cap. That cap will be reinstituted. But for this year, 2021 into 2022, whatever funds you have unspent in your medical FSA will be rolled over into 2022. Another question that came up about how do our plans cover international travel? And these plans do not cover international travel unless you've got emergency healthcare needs. And if you have emergency healthcare needs, it really isn't coverage. It's more of a reimbursement process for any expenses that you had. So there is a process and eligibility that has to occur. But if you're traveling internationally, one of the recommendations you might want to think about is you can buy travel medical insurance. Blue Cross and Priority both have those. If you're planning an extended trip internationally, that's something that probably might be advantageous because the plans here don't cover healthcare needs internationally, again, unless it's an emergency and it is a reimbursement process. So there's a cost that you'd have to pay, and then you'd have to go through the process to ask for reimbursement. Another question came up, does AD&D coverage roll over from one year to the next? The answer to that is yes. So if you want the same coverage, the same AD&D accidental death and dismemberment coverage you had in 2021, If you want that level to carry over into 2022, you don't have to do anything. It'll do that automatically. We had a number of questions come up about what about, how do I get coverage outside of Michigan? One of the examples was if I needed coverage maybe at the Cleveland Clinic or some other healthcare facility outside of Michigan. How does that work? What are the options that are available? Priority and Blue Care Network are both HMOs, which means their coverage geography is limited, mainly to Metro Detroit, and it goes out a little bit further. So most of the major healthcare facilities in the Metro Detroit area are participating with Priority and Blue Care Network. The one option is the Blue Cross PPO. So any state that has a Blue Cross network, that PPO travels to that state, and you can get coverage in a state that has that Blue Care or Blue Cross network available in that area. We had some conversation about qualification periods for Priority and Blue Care Network, as well as when you want to get your physical. We touched on that a little bit at one of the earlier questions today. So I'll just reiterate Priority. You have to qualify each year as both you and your spouse to be eligible for the Healthy Choice plan. Blue Care Network is a little bit more of a involved process to determine whether you need to qualify every year or not. It's based on several factors. So again, you're best working with your physician to coordinate that for Blue Care Network. One of the questions specifically that came up yesterday is can I get a physical in the fall, and will that qualify me for the next year, 2022? I think my response was I think it's most advantageous to get your physical in the first 90 days of the plan year. I think that's the most straightforward. Both Priority and Blue Care Network do have a look back period that you may be able to use a prior physical or prior medical documentation that your doctor can submit. The language they use in their documentation is that may be considered for qualification for the next year. So when I see the word may versus will, that tells me that it's not necessarily automatic. So again, work with your physician to make sure whatever you want to use, whatever physical or medical documentation you want to or can use to qualify you for the next year. Again, coordinate that with your physician to make sure that that your physician's comfortable with that'll meet the requirement for the next year.
What is the look back period for Blue Care Network? Do you know?
The look back period for Blue Care Network and for Priority is 6 months.
Okay, good. Thanks.
You're welcome.
Did you get through them all there, Eric?
Yes. Oh,
Okay.
wait, we have the Medicare question, which I think came up already. But again, if some questions came up about Medicare, if I'm 65 and I'm still working at Oakland University, if you're still actively employed at Oakland University, your coverage here is primary. There are some Medicare requirements and considerations, but just after, again, talking with our broker a little bit, Medicare is probably one of the most heavily regulated areas that we need to be concerned about as it relates to healthcare. And there are sort of fines and penalties for, advising employees the wrong way. So they're really trying to drive people to contact Medicare to get those questions answered. But the one question we can answer is if you're actively employed at Oakland University, even though you may be over age 65, your Oakland University insurance is definitely going to be your insurance, your primary insurance. And if you have questions about how Medicare interrelates with that or timing as it relates to when you need to apply for Medicare, there's several parts of Medicare. You're really encouraged, and you need to be contacting Medicare to try to get those questions answered.
Easy one for you. Any changes that get made, everything goes into effect January 1st?
January 1st, correct.
Okay. A question about that PowerPoint that you showed today. Is it possible for you to share it? And then actually I'm going to add to that. Yeah, this morning you sent me a list of what you basically just said with those sort of answers to the frequently asked questions. And I think you probably have a couple more that you're going to answer after today. Do you think you could add a slide or two with those answers and send me the whole slideshow, and then I could share it with our members?
Sure.
Thank you.
Yeah.
I'm sorry I joined late, but did you say does Blue Care Network have any changes to it in the next year?
None of the plans, Priority, Blue Care Network, or the PPO have any changes to the plan design. The only changes you're going to see are related to cost.
Okay, thanks.
You're welcome.
Do you have to qualify for the priority health? Not the by choice, but the more expensive one. Do you have to qualify for that? Is there any qualifying?
The choice buy-up?
Yes.
The choice buy-up is a voluntary election that people can make if they want to. I suppose if they want to pay that additional cost, you can see though the cost is pretty significantly higher.
Right, but you don't. If you get that more expensive plan, does that mean you do not have to qualify?
Correct. You don't have to qualify. You have the same benefits as the choice plan as if you did qualify. You're just going to pay the higher rate.
And we also have a question about Canada. That do you know if any of the plans can extend to Canada in terms of covering prescriptions, chiropractor, massage, PT services, used in Canada rather than in Michigan?
Yeah, I think the answer I had to the international coverage probably applies here, but I will confirm just because Canada's I think maybe a little bit different. Let me just confirm on anything that relates to coverage for services in Canada, and they've got nationalized medicine there versus our insurances. I don't think there's any applicability, but I will confirm that.
Can you describe what the look back period is, please?
Well, as far as the amount of time is the 6 months is 6 months as I understand it, and the look back period is the period of time in which the way I understand it is a doctor can either submit or provide documentation regarding the participants' qualification standards for the healthy choice plans that they're applying for, whether it's Blue Care Network or Priority. So it's a window where a doctor can submit that information relative to their qualifications for either plan.
Thanks.
Yep.
Other questions? It's very possible that Karen and I missed something in the chat there because there's a whole lot in there. So if something didn't get asked, please feel free to re-ask it or unmute yourself.
This is Cheryl. I have a question. How do you access the actual benefits book where you can compare each plan out-of-pocket max? I'm having a hard time finding it.
Sure. There was an email that went out last Wednesday that had a direct link to the Open Enrollment Guide, and when you click on that link, it will take you directly to the guide that applies to your position. That same link was included in an email that went out Monday morning announcing the start of open enrollment.
Okay, I'll look at those. Thank you.
You bet. If not, again, you can, on the slide here, we've got Corey, Monica, and Kara's email address. If for some reason you're having trouble, you can contact one of them and they'll make sure they get it, get you connected to that.
Thank you.
You're welcome.
I had a quick question about the FSA, specifically the dependent care account. I'm looking on page 33 in the faculty guide, and it looks like that's only eligible for like childcare, like daycare services, or like nanny or babysitting kind of stuff. I've got my child enrolled; she's 3 in Lowry. Is that an eligible location? Does anybody have any experience or advice on can I use that FSA to pay Lowry?
I don't have any experience whether Lowry is a qualified daycare provider that you can use for reimbursement. That would be easy enough for me to to figure out, and I can drop that in the revised slides I send to you, Amy.
Perfect. Oh, and Joe just said she used it for years. Josh.
Okay.
The other detail is that it indicates that both myself and my spouse have to be full-time employed to be eligible to use it that way. Is there confirmation for that? I mean, that's what the document says, but it doesn't seem.
So where are you seeing that in the Open Enrollment Guide?
Page 33 under the DCRA section. Looks like the second paragraph. You can use the account to pay dependent expenses if your spouse attends school full-time, mentally, physically handicapped, or employed.
Yeah, because page 33, I'm not seeing, that's not on my page 33 for the faculty guide.
So I can,
No, hang on a second. I'm looking for page 30, dependent care.
so I shared it here. This was the link that was in the chat window. I logged in the 2022 OU guide faculty.
Yeah, that's on page 30. So you're reading,
Yes, the second paragraph.
right. So are you talking about the first sentence there?
Yeah, so basically, if my spouse is not full-time employed, do we still qualify to use the FSA to pay for Lowry?
So the first sentence says this account is designed to help you pay for dependent care expenses. So you and your spouse. So it's just putting the qualification in there that basically that one or both of you are working and you have a need for dependent care expenses that you want to submit for reimbursement.
Yeah, it's just in that second sentence, basically. So then the spouse is full-time student or mentally, physically handicapped. So the rest of the language leaves me feeling like I can only use it this way if my spouse can't be home providing childcare. So I just didn't want to sign up for it and then find out later that it's not eligible and then have like tax problems in April.
Right. No, I think that second sentence is just adding additional qualifications to say, well, if your spouse isn't working as we defined it in section 1, they might be attending school full time, or they might be physically handicapped to the point where they can't care for their children. And that also would qualify for the use of dependent care reimbursement.
Okay.
So they're basically trying to say, yes, if you and your spouse are working, if you're working and maybe your spouse is attending school or maybe has some disability that prevents them from caring, those are all qualifying reasons to use the dependent care account.
Okay, gotcha. Great.
It's not
Thank you so much.
It's not exclusively one or the other or the third.
Okay, and then does anybody have experience too, like with taxes? Because there's like the child tax credit, things like that. Does using the FSA for care expenses? There was some note somewhere that said like it could you can't double submit, I guess. Has anybody faced tax hurdles by using the FSA this way?
Yeah, I'm not sure what you mean by double submit.
Yeah, there was a note somewhere that was on my mind. I kind of lost where it is in the document again. But it basically says that if you use it for childcare, you can't then, I guess maybe it's like listed as a deduction on your taxes for a childcare expense. But I'm also very new to this. This is the first month of my life that I've had a child in paid care. So maybe I can just get personal advice from elsewhere then.
Yeah, I think as it relates to your individual tax filing, your tax consequences, you probably want to do follow up, on a personal level. But this program allows you to put money away pre-tax and use that money to pay for dependent care expenses. So there is a tax savings by putting that money away and paying that way. But the individual tax consequences, you probably want to have a personal conversation then.
Okay, perfect. Thank you so much.
Sure.
Eric, can I ask you to add one thing to the PowerPoint that you send me that I'm going to send to the members? Can you put the link to the benefit guide, please?
Sure.
Thank you.
Yep, I will. Any other questions?
We have another one about out-of-state stuff. If you have Blue Cross Blue Shield, PPO, if another state has Blue Cross Blue Shield, PPO facilities, are they still considered in network?
For the Blue Cross PPO?
Correct.
Yes, and I think the example that was thrown out yesterday was the Cleveland Clinic or maybe the Mayo Clinic in Minnesota. I mean, those kinds of major healthcare facilities that are in a different state, as long as that state has a Blue Care network, generally they're definitely going to be in network. And you want to verify again. I went to the Cleveland Clinic. Before I went there, I sent them my information. I made sure that I was going to have coverage through a PPO that I had. So you always want to make sure that you're doing that advanced planning if you're going to seek healthcare services out of state to make sure that that medical facility is going to accept the Blue Cross PPO. But generally, any state that has a PPO or Blue Cross network, they should be accepting your PPO coverage.
Thanks.
Yep.
I think Karen actually just shut out because I think she had to go to class. Does anybody have any last minute questions for Eric before we wrap up? All right, so for all the members here, if you talk to anyone else, we'll get this recording all organized, get it on our YouTube page, and then Eric will get that PowerPoint to me and I'll send it out to everybody. Other than that, thank you, Eric, for taking the time, and thanks everybody for taking the time today.
Yeah, very good. Thank you. Bye-bye.
Bye, everyone.